Along with talking about business and talking about education here on the island, also immigration, people are also keeping an eye on what's happening in Lansing in terms of the budget. And one of the things that people are talking about is a possible expansion of Medicaid. Joining me right now is Jim Haveman. He's the director of the Michigan Department of Community Health. Jim, thanks so much for joining us.
Thank you, Christy.
So, first of all, talk about what the expansion of Medicaid in the state of Michigan would do. How many extra people are we talking about that it would help?
Well, the expansion of Medicaid in Michigan would add about 320,000 people to what we call the Healthy Michigan plan. And this would offer health insurance by the next 2 years upwards to 470,000 people who currently don't have any insurance. And there are 1.2 million people uninsured in this state. And that's what's interesting, about 500,000 of those are working, about $8 to $10 an hour jobs, so they just don't have health coverage.
This has been a part of the governor's platform that he wanted this expansion. It goes along with Obamacare. The federal government would pick up the tab for the next 3 years. What kind of pushback are you getting from the legislators?
Well, the legislature wants more skin in the game from people who are uninsured, and so we've put together, along with the legislature, a plan that would have kind of like health savings accounts, would have some premium payments, would have some co-pays, and would have expectations so people can work on chronic illness. 70% of the health costs in this state go for chronic illness, so it makes sense to focus in on chronic illness to reduce it. If we can do that, we can reduce. The other problem is uninsured people use the emergency rooms for their primary health care. This way they would have a primary health care physician with our managed care plans, so they would not have to use the emergency rooms.
Are you happy with an alternative plan that's floating around out there, or are you disappointed that there isn't a fully sanctioned, yes, we're going to go with this expansion?
We're happy with the bill that's on the table, but we're not happy with the fact that it has a 48 months caps on it. We know that the CMS, or HHS, will not approve this at the federal level, so if that comes off, we can put together a waiver, and we're optimistic. If we can get a bill by June 15, we could have this implemented by January 1.
Do you feel that would put us behind the 8 ball as a state if we do not move forward with this?
It would, because we'd become a donor state. People would have to pay the penalties. Small business people would not be able to offer health care. We want the state to grow. We want the state to be attractive for business growth. And the best way to do that is to lower your health care costs, give people a basic health care coverage, and their absenteeism will down and they'll be healthier.
I was just going to say, talk a little bit about how that affects business when you have people that are getting their health care and that are getting their checkups regularly, they're healthier on a whole, and they're able to go to work, and the productivity with the Michigan businesses can go up.
That's exactly the answer, and we want to continue that, and we want that to happen, because we want the state to grow and to attract business, and quite honestly, healthcare is a major industry in this state, so let's just make it work better for everybody.
So you're going to be here for the next 3 days for the policy conference. What is the one conversation that you want to have, so when you leave the island, you'll say, I know that I got the job done here this week?
I want the commitment of people who are here, the business community and the provider community, to say we need this new Healthy Michigan plan, and we need it passed by June 15, 2013.
Do you have a lot of support?
Yes, we do.
You feel confident about that?
I do. I always see the glass half full.
All right, Jim Haveman, thank you so much for joining me.
Thank you very much,
I appreciate
Christy.
it. And you are watching our live coverage of the Mackinac Policy Conference. We'll be back in just a moment.